So now if we come to the section with the clinical features are very, very important to diagnose a patient with any sort of disease, especially with irritable bowel syndrome, because there are not a lot of tests that can provide evidence of irritable bowel syndrome. So these clinical features, they usually help us in taking the history. So taking the history of a patient with irritable bowel syndrome, and the patient might complain of some symptoms, some of the clinical features. There are some signs that a patient might present with after the doctor is examining the patient. So these clinical features include abdominal discomfort or pain that could be usually all around the abdomen, constipation and diarrhea, which is one of the main factors of irritable bowel syndrome, bloating and visible distension. So a patient might present with a lot of discomfort, not usually pain, but it could be some discomfort around the epigastric region or the abdominal area. So there are some non-colonic symptoms which are completely extra-intestinal, which are not related to the GI tract. They have also helped in the support of the diagnosis of irritable bowel syndrome. That could include some epigastric discomfort or pain. It could be headache. Backache could also be one of the reasons why a patient might present with impaired sleep, chronic fatigue, increased urinary frequency, pelvic pain, and lastly, dyspareunia. So, if a female presents with specifically these three, increased urinary frequency, pelvic pain, and dyspareunia, so a pelvic outlet obstruction is also very necessary to rule out. Patients might also present with symptoms of GERD, which is the gastroesophageal reflux disease, and there are some patients who present with a musculoskeletal type of a syndrome, which could be fibromyalgia, or they could also present with a temporomandibular joint pain. So these are also very unique symptoms that a patient might present with. So now if we talk about the physical examination, as you all know, after taking the history, examination is also a very, very important part of diagnosing a patient. So physical examination of irritable bowel syndrome could include, and we could notice, deep tenderness over the colon. It could usually be more towards the left side because descending colon is usually involved, so there could be the pain towards the left side. And then just simply all the abdomen, the abdominal wall pain, tensing of the abdominal wall, and lastly, Carnet's test. So I'll be talking about Carnet's test. It's a test in which we ask the patient to tense the abdominal wall muscles. So after the patient tenses his abdominal wall muscles, there is a severe pain around his abdomen. And then there could also be tenderness. So what we are supposed to do is that we are supposed to point out with our finger where exactly is the pain, and we'll be asking the patient to know exactly where is the pain located and where the patient is having the discomfort. If we do figure out the point around the abdomen where the pain arises, we could usually treat the patient with an injection of triamcinolone and an injection of lidocaine. So this could help the patient in relieving this severe sort of a pain.